I'm good. How are you?
Good. My name's Nicole. I'm your student nurse. I'm going to be giving you a nasogastric tube today for feeding to give your stomach a rest per your physician's orders, okay?
Okay.
All right. Can you tell me your name
Sarah Jones,
and your date of birth?
4/12/66.
Okay, great. All right. I'm just going to fasten some gloves. If you have any questions, please let me know, okay?
Okay.
And the bed is in working position, working height, and in a high Fowler's position, okay? Now I'm going to assess the nares for patency. Have you ever broken your nose, Mrs. Jones?
No.
Okay. Now I'm checking for a deviated septum, which there isn't. I'm going to include one there. Can you go ahead and breathe for me through your nose? Okay, and on the other side? Okay, great. All right, so I'm going to go with the left nare because it is more patent. Now I'm going to take my, I'm going to take my nasogastric tubing, and I'm going to measure from the tip of the nose to the ear and down to the xiphoid process. And then I would mark that with tape. Now I'm going to put the tubing in ice water to make it stiff for easier insertion. Okay, now I'm going to apply clean gloves because I touched the patient. You doing all right, Mrs. Jones?
I am.
All right. Okay, I've applied clean gloves, and my tubing is nice and stiff, so then I'm going to take my lubricating jelly, and I'll lubricate 4 inches. Okay. And I'm going to place a towel on your chest, okay? Just in case we make a mess at all. You want to get your nice dry gown all wet. All right, I'm going to stick a basin here. Okay, right in your lap in case you feel that you need to throw up, okay? Okay, so now I'm going to start the insertion. If you don't mind, we're just going to tip your head back a little bit, okay? All right, let me start. All right, very good. All right, you're doing great. The head is back. Now I'm just going to check the back of the pharynx. Make sure there's no clotting, and there is not. Okay? So now I'm going to sit you up a little bit, okay? So lead your chin to your chest, Mrs. Jones. And I'm going to give you some water with a straw. And I want you to take a sip, okay? Slowly, and I'm going to take, every time the patient takes a sip of water, I'm going to advance the tube further, okay? Until I can no longer go any, okay? And if resistance is met, and this is then I would apply gentle pressure, okay? If there's coughing or gagging, then I would let the client rest, pull back a little bit, and then proceed, okay? So, I'm going to tape the tubing to the cheek until the placement is verified, okay? Doing all right, Mrs. Jones?
I am. Thank you,
Okay,
Nicole. You're
doing good.
sweet.
You're welcome. Okay. So I've asked the client to speak. She's spoken. She said she's doing okay. Now I'm going to take my catheter tip syringe and attach it to the distal end of the tubing. And I'm going to aspirate for gastric contents. And it should be a brownish green color. And I would also check the pH if the hospital required it. All right, so that is that greenish brown color. All right. And I'm going to press that back in while listening under the gown over the gastric area for swishing. Now to verify the placement, I would then send the patient for a chest x-ray. Okay, I'm going to remove the tube. the syringe, okay? And now I'm going to anchor the tubing to the nose with my Y-shaped tape. You're doing great, Mrs. Jones. We're almost finished, okay? Yep. Making sure it stays in place. And then I would attach another piece of tape across the bridge of the nose. Make sure it stays on there. Okay? Okay. Now I'm going to fasten the tubing to the gown with a rubber band and safety pin. And I'm going to make sure that I save some slack. Allow some slack for the patient so it doesn't pull on it. And I would keep the head of the bed, above 30 degrees. And if ordered, I would attach the nasogastric tube to section on low intermittent setting, and I would provide oral hygiene every 2 to 3 hours. All right, Mrs. Jones, I'm going to lower your bed for you, okay? Are you in any pain?
No.
Okay. Do you have to use the restroom at all?
No, honey.
Okay. Here's your personal belongings. The bed is at the lowest position. Okay. If you need anything, here's your call bell. Please let me know if I can get you anything, okay?
Okay, sweetie.
All right, thank you. Okay. So once the procedure is complete, I would then document the procedure. I would indicate the time of insertion, the nasogastric tube length, the size, and the type of tube inserted. I would also document the color and consistency of the drainage. I would document the client's response to the treatment, which she tolerated it well, and the instructions that I gave her, which is to call me if she had any questions or if she needed anything. And I would also document the intake and output, noting and recording the amount of drainage, and also the value of the pH if tested. Thank you.